Hi everyone. Today's talk will be on diaper rashes. This is very common in small children, and many times we get children, newborn babies with diaper rash, or children who are basically using diapers with diaper rash. Now what exactly is a diaper rash? Today we will talk everything about diaper rash in detail. So what exactly is diaper rash? Diaper rash is rashes in the area, the perianal area we say, okay. So that is the area which is around the anus, basically the private parts which are covered by the diapers, okay. So that is your diaper rash. Now it may be anything from just maybe mild redness of the skin to boils in that skin or blebs in the skin, or even the maceration or removal of the skin, or what we say desquamation, the removal of the top layer of the skin, okay. So a bare skin. This can be the range of your diaper rash, as well as a secondary infection upon this rash, which may be bacterial or fungal. So this whole thing comprises your diaper rash. Now today in this topic we are basically going to see the very commonest type of diaper rash that we see, that is because of use of diapers, okay, or any type of diapers, maybe even cloth, the ones which have a plastic covering outside. These also can give rise to diaper rash, okay. So we'll see these rashes. Now what is the incidence? The incidence can be anywhere from 5% to 35%, okay, all over world. And why so much of difference? It is because of the different type of diapers which are used all over, the diaper practices, the hygiene that is practiced, the moisture level in the air, the moisture level trapped in the pampers or in the diapers, okay. So and also the hygiene methods followed by every parent. So there can be so many changes in the way you are using the diapers. That's why such a difference in the incidence of the diaper rash. It can occur any time from 2 to 3 days of birth till the time baby is wearing diapers. Now there are some babies who stop wearing diapers after 1 year. There are some who will continue to use intermittently at least till 5 years. It all depends upon the way the diaper is being used by the parents to take care of their child. What are the risk factors of diaper rash? First thing is abnormal use of diapers, I would say, or improper use of diapers. Secondly, presence of diarrhea increases the incidence of having a diaper rash. Second is oral thrush. Having oral thrush, I'll make a separate video on this oral thrush, okay. Having a oral thrush can increase the incidence of having a diaper rash. Also, babies who are on antibiotic for some reason, because of some health issues, can also have increased incidence of having diaper rashes. How do we prevent the diaper rashes? First and foremost, see that you keep very good hygiene in the perianal area, that is the area which comes inside the diapers. We recommend that you change the diapers as often as possible, and especially so whenever they are soiled, you have to change them. Do not keep soiled diaper in contact with the baby. This happens many times, especially in India, wherein we have some functions, you are going for some wedding, or you are having some function in the house like Ganesh or Diwali, and the baby is in pamper, and the parents' attention is diverted somewhere else because of such a big rush in the house of the relatives, that the child's pamper hygiene or the diaper hygiene goes unnoticed, and that's why the babies land up in diaper rashes. And we find a large number of patients coming to us during this, following these marriage or functions or Ganesh or Diwali. So this is most important. So see that you change the diapers as often as possible. Secondly, use of super absorbent diapers, that is the ones with the gel, helps to keep the skin dry, okay. So and those which are without the super absorbent diapers or the gel, they are more likely to have rashes. Even then, personally, if you ask me, I would prefer that your baby goes on cloth diapers as much as possible. And if it is inevitable that you have to use diapers because there is no one else in the family to take care, or the laundry will be too much, because as a nuclear family, I understand these problems are there, okay, then yes, you can use diapers, but there are certain diaper manners manners that you should be using. Now, what are these diaper manners? Changing the diapers very often, using a diaper rash cream, a proper diaper rash cream, not any cream which is there on the counter, that is any cream that you want. Please do not use any creams. Then proper cleansing method. Now, how to clean the baby's buttock, I have made a separate video on this on my YouTube channel. I think that's my baby's bum is red, how do I take care? So basically, remember, if this is baby's bum, you are not going to wipe the bum this way. So your action should not be this is friction. Your action should be dabbing action. So just look at my action, this is dabbing action. Okay, so your action should be dabbing actions and not this thing, friction. Okay, it should not be moving like this. So this is very important. Then use of a petroleum jelly or a layer of oil or zinc oxide. The best is zinc oxide. Use of zinc oxide on the area before change of every diaper. So this forms a barrier between the skin and the material, that is the diaper material, or whatever is there in the diaper, the susu or the potty, whatever the baby has done in the diaper. It forms a layer between this thing, the healthy skin and this material. So that's how it prevents the baby from getting dermatitis, that is the rashes. Now basically a diaper rash is a contact dermatitis, that is when something which is abnormal comes in contact with the skin, then there are higher chances. Now especially so, as I said, even the formula fed babies are more likely to have formula fed, and the solid food, the babies who are on solid food are more likely to have rashes because the stools are more acidic. So they come in contact with the skin and cause irritation to the skin. Now once the baby has got rashes, how can you treat them? So whatever I told is to prevent from the rashes. Now once the baby gets rashes, how do you go about it? So when the rashes are in their first stages, when you find that the baby is passing motions too often or there are loose motions, start taking care of the skin. It should be taken daily, but if you are not taking daily, then at least once the baby starts passing loose motion, see that you start taking care of the skin the way I have told. Also see that you clean the baby's buttocks with dabbing motion. If the baby is a bit bigger, then you take the baby directly to the tap and keep the baby's buttocks under the running water so that it is easily cleaned. Or maybe you can use a squeezy bottle and clean the baby buttock, or maybe you can keep the baby in a small bath or tub bath and try to clean the baby's buttock with a little bit of warm water. So soaking can help in removing this dirt easily. Also, you can use potassium permanganate powder, very little amount in water, so that water turns just little baby pink color. Warm water with the potassium permanganate, see that all the crystals of potassium permanganate are nicely dissolved. Otherwise, if they stick to the baby's skin, you will get some brown color marking on the skin and the parents may simply get scared. Nothing will happen to the baby, but it looks a little bit awkward. So see that you mix the potassium permanganate completely in the water and place the baby in this water for at least 1 or 2 minutes. It is antiseptic basically, so it will help the skin soothe. Second, one more home remedy that you can use is the black tea. Just take 1 glass of water, add 2 or 3 teaspoons of black tea in it, boil it till it decreases to around 3/4 of its size, the amount, and once it is 3/4, strain it, cool it, put it in the ice tray and keep them in the refrigerator. Whenever the baby has redness around this perianal area, take 1 ice cube, simply apply it in that area. It soothes the skin, plus it is an astringent and it is soothing for the skin, so baby will like it. Okay, there are some babies who don't like very cold things placed in this private area, so you may not do for them. Then third thing, when the baby gets rashes, you can start using whatever zinc oxide cream that you are using and use it for at least 1 day. But in this 1 day, if you find there is no improvement or that the skin is chapping, that is bleeding, there are cuts at the area, then it is your time to visit your doctor. Go visit your doctor because he will have to see whether there are any other problems over there. Also, when the baby gets diaper rashes, it is best to keep the baby without diaper, that is basically keep them open or keep them with cloth diaper. You can use this something known as under sheets that you get, so you can place them under the baby so that baby doesn't soil the bed. Okay, and also when at least for 3 to 4 days you are not going to use diapers. Keep that area dry by air drying. Now if it is not possible to just air dry the buttock area of the baby, then you can use your hair dryer on the minimal setting, that is not on the heat setting, just the blower setting, okay, without the heat, and dry the buttock area for at least 30 seconds to 1 minute. That will also suffice the same purpose. I hope this talk of mine, I have tried to complete all, take all the points, and I cover up all the points. If you find that this is helpful, do share it. Follow me on my YouTube and on my Instagram handle. If you have any other questions, please ask me. This was one of the questions asked by a parent about diaper rashes. I will also make a separate video only on diaper manners that you should be following. I will do it some other time. Okay.